I wanted to respond to this real quick. So I made a video and I said, hey, listen, you know, if you're not getting protein, really makes no sense to do a bunch of strength training. You're actually hurting yourself more. So Summer, who's a registered dietitian, I actually love her channel. She said, I respectfully disagree. You should absolutely strength train even if your diet isn't great. I want to talk about a few nuances here. So I think the message of, you know, first of all, none of us are ever going to reach perfection with anything, right? So of course, if you don't have a perfect nutrition, I think there's a big difference between not perfect nutrition versus going on empty with protein. Okay. So there's that. Also, I think there's lots of things that are left out of this comment. Like, I really always agree with, you know, we're always inclusive and all those things. The problem is, like, some people, they're not easing into strength training, right? Like some people, they're doing 1 hour strength training circuits for 3 hours a week, and then they're running on E with the protein. And let me tell you who I'm seeing this in. Okay. I can see this in patients. This is what I'm increasingly seeing. So as coverage is going up for 65 and over, right? We're having Medicare cover different GLP-1s and stuff like that. So I have, and by the way, the term that we're going to use in medicine, 65 and over, is going to be geriatric population. There's a reason I use this. They are so at risk for muscle loss. And so I watch them like a hawk with body composition testing. And the thing that I really see is, I'm going to have to respectfully disagree with you when I'm holistically following them in the clinic, right? When we're not doing siloed medicine. So it's not just like a registered dietitian over here and a doctor over there and an exercise person over here. When we're doing it all together and you're all seeing the patterns, my patients 65 and over, if they are not getting enough protein and they're just jumping into strength training, they are losing those high percentages that you would see, like the 40-50% muscle loss. It's horrifying. And honestly, I really think when you think about strength, longevity, fall prevention, all of that stuff, when you think about holistically, what do I actually want for this patient? What do I want for their life? I would rather, frankly, that they wouldn't have lost those 10 pounds if 5 is going to be muscle. Like that's me personally. I know that they're in a worse spot if they're losing all that muscle compared to if they'd held on to it. And the way that we get around this is not siloing medicine, not sticking everybody in their own camp, really looking at everything all together. And sometimes, no, I disagree. It's not strategic just to be like, whatever goes, however you want to do it. It's not strategic. So this answer, when you're like, you know, nope, start strength training whenever you want, don't worry about it with the diet. Like, I know that's not all that you're saying. We get so few characters on here, but no, it's not strategic sometimes. And when I see most people, when we're doing it at all within the realm of reality, no muscle loss or very little muscle loss, and then you see someone where it's really gone off the rails, you would get on here passionately too. So it's really interesting when, you know, I actually love for us to have disagreements because it brings out in me, why am I so triggered? And it's like, oh yeah, because I'm seeing patients 65 and over. I'm so glad that they're getting this help. I want them to be safe about it. And it doesn't take a lot, but sometimes we can't be permissive about it because their life suffers. So I think that's my main message.